One of the many people who took advantage of seeing a doctor virtually. Good news, many telehealth services will continue in Virginia, even as the COVID-19 public health emergency has expired. Riley Wyatt on your side at 6 with what you need to know.
Telemedicine greatly improved access to health care, and the General Assembly took note. Now, many of the waivers that expanded telehealth have been made permanent thanks to Virginia lawmakers.
That's kind of a no-brainer. Like you don't have to take off work, you don't have to find childcare, you don't have to get transportation.
Prior to the pandemic, there were only a few services provided via telehealth.
That list has grown by leaps and bounds because of the pandemic the last 3 years. The mantra has been like people should get care anywhere they are when they need that care. I think we're just changing the way that the healthcare system operates.
The expansion has not only benefited patients, but also providers.
We have seen and heard just anecdotally that the no-show rate has gone down significantly.
While many waivers were made permanent, some are still set to end. One of them, the use of platforms that don't comply with HIPAA. During the pandemic, things were more lenient and doctors could use FaceTime or Zoom for virtual visits. Now that won't be allowed. In addition, you won't be able to get certain prescriptions without visiting the doctor face-to-face.
When the federal emergency ends on May 11th, that goes back to you need to have an in-person visit before we can prescribe controlled substances. And it's particularly hard for mental health because many providers have actually flipped to all virtual practices now.
For a full list of the services here to stay and those being phased out come May 11th, visit our website, NBC12.com. On your side, Riley Wyatt, NBC 12.
All right, Riley, thank you.